Listen-only mode.
Hi, my name is Margaret Millward. I'm one of the specialists with the Quality Improvement Planning group, and I'm joined here today with Terry Donovan and Patricia Dwyer and Linda Valente, and we have some colleagues on the phone as well that are here to enjoy this session on primary care quality improvement plans, getting you ready for 15-16. It's kind of hard to believe that we're already talking about that now, but it's really critical with quality improvement planning to start planning today. So I'm glad that you're all with us. So to participate today, you can click the orange arrow and open up your control panel. You'll be able to chat in using the questions section, and so if you have anything you'd like us to address, please put that in there. You can also just put comments in if there's things that you'd like to share with us. We do have you on mute just because it helps to keep the sound control as good as possible. So we're hoping that you can chat in now and just let us know that you can hear me. So if you could just, a couple of you put in a note to let us know you're hearing, that would be wonderful.
Yes, thank you.
All righty, so we can move through this. So today for the agenda, we're just going to do a brief overview of quality improvement planning. I'm going to go through the different components and apply quality improvement planning strategies as we go through the Navigator, which is the online tool, and we'll also be doing a demonstration for some of the new enhancements that should help you with your quality improvement plan this year. We expect by the end of this session that you'd be able to understand quality improvement plans as a tool for driving organizational quality improvement. Help you to understand the expectations for this coming year. There are no new indicators, but some new sections as QIP becomes more mature. For those of you who are new, you can be introduced to some of these sections like the login, the resources, the sector-specific QIPs, progress report, narrative. We will be reviewing the submission process and describing the suite of supports available from HQO. So this is just a quick picture about Health Quality Ontario and our role in quality improvement. So we really see quality improvement plans, they should be clicking in there, there they are, as really central to the quality improvement journey. It brings common focus, it brings information, and also can be used to help build collaboratives or communities of practice. We're doing a lot of work now provincially with the sectors in trying to help people understand the role of quality improvement plans, and also some of the synergy that's developed throughout adding all of the different sectors together and the strength of the quality improvements now. So this is the third year for primary care. It's kind of hard to believe. I was there since the beginning with some of my colleagues in the room and on the phone, and really I'm happy we're not dealing with those Excel sheets. They were were particularly brutal for some of us to deal with, and I know from talking with a lot of you that you had struggles with those. But now for primary care, you've implemented quality improvement plans, you've started to understand the standardization of indicators, and so now in this coming year we should be looking towards benchmarking and targets of indicators. So we have had some developmental indicators and difficulty with data quality around some of the patient experience survey information, but we're trying to build things to make it much more robust, and so that you can start to see what's happening around the province. As some of these indicators become benchmarked and we know that the performance has improved, you might find that they move off QIP and off into more of an accountability area. So you may see in the future new indicators coming in that are provincial priorities, and again you may see indicators moving off the QIP and becoming more of an accountability measure. So I'm going to ask my colleague Terry if she could run our first poll. So we have, how familiar are you with QIPs? So this is just to get a sense of who's in the room with us. I know that there is some turnover in your positions and just changing of accountabilities within your team. So if we could just see who we have and how familiar you are with QIPs.
We have about 75% voted, so we'll just give another 5 seconds or so.
All right, I'm seeing that the indicators are slowing down there. Terry, if you could share with us what we have. So it looks like the majority of people here have been are familiar with the QIP, so that's 60%. Somewhat familiar for 37%, and a couple of newbies, but most people are quite familiar with, it looks like, the quality improvement plans. If you do have people who would like to learn more, we will be posting up these webinars so that you can go back to reference them, and there is material within the Navigator that you can review as well. So let's go, getting started at the QIP Navigator page. So we posted that up. Most of you should already have your login information. However, if you don't have it or you're new to your program and you're not sure, you can contact us at QIP at hqontario.ca. And for those of you who have misplaced your password, not that that ever happens, please use the little orange button in the bottom that says you've forgotten your password, so that can be reset. This first page just provides an overview of the purpose of the Navigator. You'll see in the front page there is a resources page, and you can click and get specific information about primary care resources. So we've got some particular resources in there that you can click on, and they're all hyperlinked to help you with your journey. There's also a section called Sector-Specific QIPs, and that is an area where you'll be able to share your quality improvement plan. So you'll be able to see hospitals, primary care, CCAC, and long-term care in the future. So it will be very helpful, particularly if you're working in health links and you can see adjacent organizations. May not even be your same type of organization, but you can see who's working on what, or if you have organizations with the same type of model, you may want to be looking at some of their information as well. So you'll be able to access that. Up at our QIPs section, you'll be able to see your organization, and you'll be able to see the following, sorry, the previous years, and you'll be able to use the edit and submit button for the 15-16 once it's been launched. So this, our QIPs is really the dashboard of what QIPs you've already done, and it will continue to accumulate. so you'll be able to see your data over time. Our next section that we have is the narrative, and this is a particularly area that I am interested in around. So you've got your narrative, your work plan, and your progress report. But the narrative here is a place where you can really provide the context for your quality improvement plan. We know that quality improvement is not all plug and play, that this gives you an opportunity to talk about your unique environment in which you're implementing your quality improvement strategies. And we're quite interested in learning more about those relationships. This is very teeny tiny writing, so I hope a lot of you have your progressives on today, or maybe you have a big monitor in your office. You'll be able to look at this more clearly in the application once it is up and going. So when you're getting started, it's really important to look at your progress report. So what have you been doing in this past year? What is your current value now, which will be the same as what you will record in your work plan. This also, you'll be able to export this information and share that with your quality improvement team. Again, see the red font is indicating priority indicators. So those are those provincial indicators that all primary care are working on, and you know, it certainly takes more than just one primary care organization to really move these metrics. So they're quite a priority within the province.
And Mark, I just want to say the progress report, I'm happy to report, is working much better for the primary care sector this year. Last year it was very limited in the functionality. However, it will populate with all the information from last year's QIP. So and it's quite intuitive, but I think it gives an opportunity for the primary care sector to really share their progress achieved and whatnot.
Yeah, I'm quite excited about this new progress report, where it also gives you an opportunity to talk about, you know, which change ideas you did implement as intended. Sometimes we know that things change over the time that you are doing your PDSA cycle. And we do know it's as important to understand which ideas don't work as which ideas do work. So asking you to comment on really in your lessons learned about, were these things implemented, are they getting results, have you changed it? You may find that there's other ways that you're testing something that's more effective. So it will be really interesting to see these being pulled forward and being able to share these in our analysis reports going forward, and for others to be able to see this information and to share the learnings and key findings about which ideas are effective and will improve the efficiency and patient satisfaction going forward. So again, this is the narrative. So it's talking about the context of your quality improvement plan. You're able to put in your organizational logo, and you're also able, once you complete it, or even in drafts, you can export from the narrative. Just to let you know, we've had some changes within the within the Navigator as far as the types of font and so forth that it will take. So it's just really using plain text, and we're really encourage you not to try to put any pictures or tables into this. it seems to cause issues. So please just keep it as the plain text. And again, if you remember that this is a public document, trying to write it such that it's really clear and concise so that really anybody from the public could look at it and understand it would be helpful as well.
Once organizations export, if they want to at that time, once they get to the final drafts, do some formatting and add bullets and whatnot, they can certainly do that to post it publicly. But within the tool itself, there's no formatting.
Yeah, I would think you might want to jazz things up for your own website and make it more attractive graphically. But we're pretty basic.
Yeah.
We just want to know what's working and what your environment's like. So again, there's a new section within the narrative, and you'll see quite a focus with the ministry and HQO on patient, resident, client experience. So it's called different things in different environments, but really moving toward engaging patients, working more in partnerships than just satisfaction. So, thinking about, could you consider having patients on your redesign work? Maybe you're looking at something in your office that will give them more opportunity to have time to be able to ask questions. So instead of, just a survey, you may want to consider actually involving people right in the work and getting much more commitment from your community as far as quality improvement. The work plan, which a lot of people focus a lot of their energy, has changed a little bit this year. We've tried to allow for more green space, or focus on the change ideas. Now that people are more familiar with the indicators and how to get to those numbers, now really focusing on implementation and what are those things that are going to move those metrics. So really looking at focusing in on how are those change ideas going, and looking at the process measures so that you measure how those are progressing as well. We'll talk more about that as we go in the demo. If we look at the blue part, which is the measure section, again, reiterating that the red font are the priority indicators, and so that's really wanting standardized measurement of the indicators. Some will be pre-populated. Obviously, you can't do that with survey information, but we're talking about working on the integrated indicator going forwards. There's also additional indicators which are available in a drop-down. For some of those ones that people worked on last year, you may not be able to see them. They're kind of collapsed, but if you want to continue to work on those, please feel free. And there's also an option to create other or new measures, which you'll see shortly. I put in a bit of information about our new yearly report about measuring up, because I think a lot of people have wondered about these surveys and the survey questions and what is going on in the province. So I've given you a reference for that. If you go to the HQO website, it kind of pops out at you anyway, so you can see it there. This is an example of the access indicator. So in the quality improvement plan, 4 of the indicators are patient experience, and so they're related to survey questions. I think it's interesting to understand that there's been a lot of interest in this from the Commonwealth Fund. This is where this chart comes from. And so comparing us internationally. So you see Ontario's at 40%, and Germany is at 72%. So that's an international, and it's a patient-level data survey, whereas the QIPs are at an organizational level. So we do have to be cautious and understand that that's a little bit different, but at least we're starting to see some of this information. And just for those of you who aren't familiar with the indicator, it is actually about a question in a survey and looking at the response of same day and next day. What we've done this year is build the survey responses right into the work plan, or the blue part of the measures. And you'll see in the red box a little button that has survey. So you're actually looking or counting the number of responses within the software. So we have the specific questions written in, and so that you can actually just write in the responses of how many people said always, often, sometimes, rarely, or never. And the good news is that this functionality will now do an auto calculation and to give you the percent value. It will also help Health Quality Ontario as far as analysis, because we will know that you're using those questions, and we will have a little better understanding of the power of the results by knowing how many people are actually being surveyed. These are some of the other questions from the priority indicators, but these results are from the Health Care Experience Survey, which is a Ministry of Health and Long-Term Care survey where they call patients randomly and get the responses. So this is the one about always gives enough time or opportunity to ask questions. So you can see what's happening in the different LHINs. And in Ontario, that's, I think it's 83.3%. So just it gives people a little bit better understanding, I think, of some of these indicators. This is the one about always or often involves them in decisions regarding their care at 85%. So you can see people, for the most part, are pretty happy. And percentage response about provider always or often responding that they spend enough time, and so that's 82%. So I think that that will help you as you do your own internal surveying and can think about what's going on in the rest of Ontario. Again, we have the priority indicator from the integrated attribute about the post-primary care discharge visit. And again, just a reminder that it's not everybody that you have to see within 7 days who's been in the hospital. So there's specific areas, and so things like stroke, COPD, pneumonia, some of these more complex situations are the people that this really targets. We do know that this has been or is really a developmental indicator. So people are getting this information from different sources, and there may be some difference in how things are being counted, but the important thing is that people are paying attention to this and building the bridges with their hospitals, with acute care, to be able to get those discharge reports and to be able to get those appointments for those people with those complex situations. Is there any questions at this point right now? That
we do have one. Can we get more info on how this is calculated, the list of specific areas, also which hospitals are included? Some patients go to a hospital out of town, etc.
So as far as the integrated indicator, it comes from administrative databases. So it is coming from all hospitals. As far as areas, it's all areas of the province. So it's looking at the hospital discharge data and comparing it to the primary care provider data. Anything else, Terry? That
no, that's it for questions. Oh, one more. Can we get more recent, timely data?
Yes, we would all love to be getting more recent, timely data. We will be hopefully populating this as soon as we get the more recent data cuts. There is limitations, however, with information coming out of the hospital. They have to code the people as far as what their diagnosis is, and then mix it with the data from the primary care. So there is a delay there. What we're seeing in the quality improvement plans is that people are doing manual counts as a part of their quality improvement work. Often we see that in the process measures to a change idea, such as when you do get a discharge note from a hospital, and then how long it would take to actually visit the person. So people are creating their own measures. We're also seeing in some LINs where they have made those electronic connections so that people can get that data. But I think you'll see a lot. It's an indicator in health links as well, so it certainly is a priority, but it certainly is not easy for many people to get really relevant real-time data. So, but I think you'll see it's evolving.
Thanks, Mark.
All righty. So the work plan. So there is a work plan section for other indicators. So you can add whatever you want. So if you have a specific local initiative that you would like to work on, that's the spot to put it in. I would encourage you to have a look at, again, another busy slide, but it is on our website, the Primary Care Performance Measurement Framework. So you don't need to be inventing your own indicators. Many of these things have been studied, and there's a lot of consultation and energy being put into trying to have common indicators so that people understand the data sources, that they're measuring apples and apples, not apples and Tuesdays. And you'll find some good information about some of these being implemented. So I would have a look there if you're considering looking for new indicators. Then you can put the information directly into the QIP and talk about you know, why that's important for you, and be putting in change ideas to go along with that. Now we've got a little poll coming up. So these are the 5 priority indicators that are with primary care, and we're asking you about which ones you're planning to focus on this year. So some of you will focus on all of them. Everyone will be asked to comment on them. Some people may already be doing a spectacular job at some of these and be choosing to focus, needing focus on other areas. So we're just asking quick so you can put in which ones that you're planning to work on this coming year. With our poll, so you're just giving a little.
Yeah, we've got about 50% have voted, so I'll give them another little bit of time.
Mm-hmm. Any questions coming up as we're counting?
There's one question here. My understanding is that data being pulled is from OHIP data. CHCs don't bill OHIP, so how is the data being captured for CHCs?
Well, there's a good question. So that's been developing through ISIS, and the contact at the CHCs is Jennifer Rayner. So she is collecting practice profile information, and they've developed a way to get that data.
Great. Okay, so I'll close the poll now. And
drum roll, please. So we're seeing that the most people are working on access, and that's wonderful to hear, especially when we saw those results earlier. Integrated, followed by having enough time, and I think involvement in decisions of care would be next, and opportunity to ask questions is probably the lowest at 40. So, but great to see everybody, a lot of commitment there, particularly to access and integrated.
So we've had another couple of questions coming in asking about data from the nurse practitioner-led clinics and AHAC.
So again, I believe that there is work in the works on those, but yes, we know that you don't have that information available. So all we can suggest is to try to get some manual data around it, whether you're counting, who's coming out of the hospital and whether or not you're able to see them. We do know that also with this integrated indicator, sometimes there are too few people to actually put a number up, so the data can be suppressed if there's less than 5. So for some of you, there won't be a value just because you have a small practice. You can still put in change ideas if you don't have a value, but you feel it's important, or you're part of a health link or a regional hub where you're building infrastructure to support having that information and making sure that those complex clients are seen after they've been in hospital. So talking about change ideas, so as you're moving forward once you've got your measures, you want to be adding the change information. Just a reminder, there's lots of resources out there, particularly in the compass, which is on our website. So there's the primary care tab, person-centered tab, and a transitions tab. You'll also see lots of resources in our quality improvement primary care webpage, and it gives links to information on advanced access. There's some web modules with the Mac Health, which are wonderful, and there's also some change packages on the best path pages that talk about transitions of care. So, and there's always work evolving with HQO. So I'd just keep an eye on the compass and our website. All right, so and this is more detail about the change section. So this window opens once you start to work on a change idea. Let's see, there we go. Okay, so when we talk about change ideas, it's also called plan improvement initiatives. You also hear terms change concept, best practice, evidence-informed practice. Any of those types of things can go under that heading. The methods is asking for a little bit more description than perhaps you're doing something on advanced access and you're looking at supply and demand. That might be what you're putting in as your change idea, that, some work around that. You may want to put specific steps in as far as your methods. And then with your process measures, actually having, again, something that has a number on it. So things like third next available appointment might be something that you're measuring, and you might be measuring that once a month, might be at a specific number of practices, but really trying to target what it is that you're doing in a measurable way. And then for your goal, having specific measurable goals. So having things like you would like 100% of your practices to be doing whatever this activity was by January 2016, or you could break it up and have some incremental change that you're putting in as you're going forward. Many of these strategies aren't sort of that one-off, a big bang for one particular month. So consider trying to break it up into bites that you can actually manage. And comments, if you have some kind of something happening at your site, maybe merging or getting new staff or losing staff or something that would be a constraint or an enabler, we're always interested in learning more about how it's going out in your area, so feel free to put some comments in for us. So our last poll is talking about SMART goals. So quick question in the poll about looking at the definition of SMART. So which one of these attributes is not part of a SMART goal? Give you a couple of minutes here, and we will be reviewing the supports and then going over to a demo very shortly. Any questions while we're pop along?
There's just recapping when the deadlines are for submitting the progress report and the QIP. So just a reminder that all three components of the quality improvement plan, the narrative, the work plan, and the progress report, when you hit that submit button, all three of those components go together. They are all due by April 1st. If you go to submit and one of them is not completely filled out, it will not take a successful submission. So all three must be completed by April 1st, and when you hit that submit button, they all submit together.
So, and just from our past experience last year, I would really encourage people to try not to do it, 5 o'clock on the last day. You can run into technical difficulties, and please, try to keep working on it throughout the year so it's not, that last-minute dash. And there's one question, once you've submitted on April 1st, are you able to edit or update, change anything? So not within the Navigator. However, we would really encourage you to be keeping your own progress to date and updating your boards, your teams that you're working on, either monthly or monthly would be preferred, could be quarterly, but you should be tracking this throughout the year. Unfortunately, right now, the QIP is really just a snapshot once a year, but we do realize it involves a lot more work than just that once a year submission. So let's see, did people know which one was not a part of a SMART goal? So it is, yes, we have. It is monthly. So although you may want to measure things monthly, the M in SMART is for measurable. So just a reminder, and certainly the clinicians should be familiar with this as far as as goals, but we want them to be specific, measurable, achievable, realistic, and time sensitive. Alrighty, so we're going to go on to the next slide, which is talking about some of the supports at HQO. So we've reviewed the resources on the Navigator page, so there will be the guidance documents from the ministry, which will describe the indicators and also some sort of generic tenets of quality improvement plans, some good advice as far as governance, engaging patients that is really critical to QIPs. And then there's some analysis reports will be available within the resource page. Measuring up, I've given you the link to that in the earlier part of this section. So our new annual report, the primary care performance measurement framework, again, that very busy placemat of indicators, but a really good reference if you're interested in looking at, maybe you're looking at diabetes or some other chronic illnesses or cancer. There's some super suggestions and more technical information about, what you need to consider. The quality compass, so that has those change ideas, the best practices, different ways to measure, process measures, outcome measures, all kinds of things. I have put in here the primary care practice report, so you can email pcreport@hqontario.ca and have information available at your physician level as well as your group level, so that might be helpful. And the primary care webpage. And if you have specific questions related to QIP, you can send a note to us at QIP@hqontario.ca, which has been very busy lately, so we get back to you as soon as we can. As far as, if you're looking for some feedback or resources, please send us a note. We'd be happy to help. So as I'm going to be getting ready to get this demo going, is there any other questions or comments at this point, Terry?
There's a question. The PC practice report is not available for CHC physicians, is it?
CHC's primary care practice reports are available through Jennifer Rayner. I think it's London. She's in decision support. I would contact AOHC and ask for her contact information if you haven't received that information. Okay, so we'll be starting the demo shortly, starting with the login.
Okay, so similar to last year, you will use the same login information.
And again, if you can't find it, you can email us at QIP@hqontario.ca.
So we have a reminder pop-up message here. So we will only use this throughout the year for any key messages. So right now we're just saying that we're just waiting on the QIP guidance documents and those technical specifications, and we will, as soon as they're available, they're just putting the final touches on it, then we will open. So we're asking you to please check back soon, later this week in fact, and we hope to have the site open. So, and you'll know when it's open because when you go to your QIPs page and the QIP submissions, you'll see that the 2015-16 would be in progress. So this is just our testing site here. Your 2014-15, your status there will say submitted, and it will be view only. So to work on your quality improvement plan, you're going to go to the edit button, and this is the dashboard, and again the edit button that you'll go to throughout the year, throughout the QIP submission time and until you hit submit. So as Mark had mentioned, there is one new patient resident engagement field. All of the question marks are hover help and will guide you with what information is required for those sections. You'll notice if you click over the question marks, and if you click on it, that will stabilize the hover box. And then if you go to the very top, so not the side or the bottoms, but the top, and you get that four-pronged arrow, you're able to move that, that question or that hover help around the screen. So if I was going to, again, add into integration and continuity of care, I can click on the box when it's highlighted, or I can click on the heading, and you'll see just a plain text box. So again, we've removed the formatting that was there last year that was causing many issues and bugs behind the scene and slow systems and everything else, so we have removed it. We are looking at an alternative web-based tool editor, if you wish, but we were not able to find one that was stable prior to launching. So it is something we will continue to look into, but at this point there's no formatting available. So again, if I click on the question mark, I can read the information here. So I'm looking to describe how the QIP promotes integration and facilitates continuity of care for the patients. So you can begin to work on and you can just start to put in information. You can go back throughout the year, have your colleagues go in, add to it, and you'll see that it'll say whatever information that it is that you put in there. Likewise for overview, you can take a look at last year's quality improvement plan. You can copy and paste and then tweak it or revise it and update it. So you don't need to start from scratch. You can look at your strategic plan or your operational plan and build from that.
But we do want it in really concise, easy language so that public could comprehend it, and but also looking for that alignment is really helpful.
Right. So I'm going to go back to the dashboard for a moment and just show you, we have turned up this progress, the status progress. So now if you look here for the narrative section completed, you'll see that you've got 2 out of 8. So it by no means measures how much information or how good the information is, because I've only put in a sentence. But it does help you just at a quick glance look to see, okay, we've started at least working on 2 out of the 8 sections, and then likewise that'll be the same in the work plan and the progress report. So if you log in March and you're seeing only 1s and 2s or 0s there, you may want to set some time to start focusing on this. So I just wanted to demonstrate how that works. For the next is the work plan, and we have made, like Marg mentioned, some enhancements here. We've tried to focus a little bit more real estate space on the change ideas. We have also, based on feedback that came in, reduced that blue overlay that made it impossible to see what was behind. So that shading we have reduced. So we do listen to the feedback we get, and we try to implement as much as possible. But as I say, it'll never be perfect, and so please continue to provide us with that feedback, and when we close down over the summer, we'll continue to improve. So we can demonstrate the new survey functionality here. So if I look at the indicator for...
Let's look at involvement in decision making. It's that one there, Terry, that you're hovering over? Right
okay.
There. No, the font is really small. Just a tip, and if you're fortunate enough and you're working on this A lot of us use a second monitor to work on QIPs. If you have that available or getting a cord to your TV, it can really help being able to look at last year's information or resources and then putting the information in. So it might be something you want to talk to your administrators about to get. But so we're looking at this one. So in my survey, I surveyed 110 people.
Okay, so I'm going to click on this survey button here, and a new window pops up. And again, the question is repeated. So
yeah. So I would have 45 people said always. Is that one we're in?
Yeah. So I'm going to because I had put that in there.
Information.
Yeah. So
okay. Can we just stay with this one for a second?
Yeah.
Okay. So if we go with this, we've got the information in. So let's go save.
Okay. So because the information's in there, if we need to change it, we need to. So if new surveys came in and the data changes, we need to change it on the fly. So.
Okay, can we just save this and say that this was what we got? What I was wanting to talk about was so we have 75% for this. What I wanted to talk about was the targets. So we looked at the Measuring Up document, and it said that the provincial average is 85%. So right now I'm at 75%. So would 85 be something that I want to go to? So let's see, like, what happens if we put in 85? What does a relative target look like? 13.33%. So some of us would say, like, that might be a lot of work for 13% increase. And do I want to be average? I don't know. Let's say I was in HNHB and their value was 85.9%. I guess that's not really going to make much of a difference, is it? So what would happen if,
just plug it in to see.
Okay, let's say 85.9, because that would be the average of, I want to match H and HB. 14.5, maybe almost 15. That might be a little better. Or, you know, you might look at, I think 90 was the highest performer. Let's put in 90. So that's a 20% increase. So that might be something to write in there that, you know, for your justification, you wanted to match the top performer for the province with that health care experience survey. Of course, the theoretical best is 100%, and some people will write that too, but not sure that that's as realistic. So those are some of the things you might want to think about when you're doing that. Let's try another one. Yes, is that the enough time one? That's the...
Spend enough time with them, yeah.
Enough time. So those are things you'd be thinking about. What can you do in your office and redesigning those things? So, but let's say that always was 40%, or sorry, 40 responses. So these are the actual people who said this. It's not the percent. Let's say that 35 said often, and 10% said sometimes.
10 responded.
Sorry, yeah, 10 said that sometimes. 10 said rarely, and 5 said never, and 10 didn't respond. And let's look at that value. 75% again. I did that on purpose. Oh. Terry's going, really? What are you doing? But anyway, it's a little bit different, but it still does the auto calculation. Again, you could look at your measuring up. You might have a conversation in your LIN, you know, with your other CHCs or your family health teams, saying, okay, what is realistic for our site to do those targets? I'm going to put you should be having this measuring up document open at the same time. I don't have that available, but again, it is on our website. So in the meantime, we're having a question. This is good. Stay here.
Okay.
Okay. So the other options you see there are collecting baseline, and I don't think anybody should be choosing that this year. I think everybody's been working on these for a while. The suppressed. So the suppressed is where you have less than 5 people. So it really shouldn't apply to the patient experience questions, but it could apply to the integrated. I think there was almost 40% of the data was suppressed because of low numbers. So if you don't have a value, that's okay. You can still work on ideas to improve that experience, because those are the people who may be very expensive, but you don't want to identify them in your quality improvement plan, because people might assume like, oh, well, that's Jane or Harvey. I know, like, he goes to the hospital all the time. So you don't want to be invading people's privacy with this low numbers. All right. So we can save and close. Great. So I think the other thing that we wanted to show is maybe you could show the population health indicators, how they are collapsed at the bottom there.
Yes, so these have all been, the additional indicators have been moved down to a drop down. So they are not mandatory by any means. If you want to continue working on them, you certainly can. And to trigger them in order to stay on your quality improvement plan, you simply need to put in a target. And once you put in the target, if we had current performance, let's say 70, we want to jump that up to 85. As soon as we put up the target, save and close, then that triggers that this indicator will now be present on the quality improvement plan.
Yeah, and you can see at the bottom is where you can add a new measure.
So here you have your blank slate, and you would create it from by including the objective. There are some in the drop down, so you could still have the same objective, but if any of the different attributes were different, whether it's the population or your data source or your time period, this is where you would include those different attributes. If they're not listed in the drop down, then you would leave it as other, and you would specify here. HQO will monitor this, and if we see there are trends, we will update the drop-down list accordingly. We do look at the clusters of the new indicators, so trying to get a sense of what it is that people are working on, and you will be seeing a report about that. I think we're talking about the beginning of December now, and it would be included in the resources and analysis of what has been seen. And as Marg mentioned in her presentation, the Common Quality Agenda form there is a really good start on how to build an indicator from the ground up and what is needed. So you'll see there's a delete this measure. So this function will work for only those indicators that have been developed. If you do go to try and delete a measure that is a priority measure, it'll let you know that deleting this indicator is not permitted as it is predefined. If you're not working on one of the priority indicators, you do not need to put in a current performance or target justification. You would only put in the comment section. So I'll show for this very first one, we're going to leave all of this information completely blank and go to the comment section, which is normally optional unless unless you're providing that rationale that, that you're not focusing.
I see somebody has their hand up. I'm wondering if you could write in your question or comment, Pauline. And if there's anybody who would like us to demonstrate or go back in or through part of the Navigator for the resources that are available on the HQO website, we'd be happy to show that to you now, if you have any.
Yeah. So I'm going to show the one of the enhancements that we did for the submit. So you'll notice here that I've left some blanks. This first indicator here for the patient's clients able to see a doctor or nurse, I haven't filled in any information but the comments. So this one, which is ID 1, should submit successfully. But
can you talk about the ID 1 again, just because they might not have seen that? Where that is?
So there's a new, on the left-hand side, there's IDs for each of the indicators, and we've ID'd them in order to guide users when they submit where that missing information may be. I know last year it was very frustrating for users to not be able to successfully submit because there was some missing information, and we would have to go through, like, fine tooth comb to look for those blanks. So now we have identified where they are, and so I will show that. I will show that now. So to submit, we go back to our QIP submissions, to our dashboard, and again, you'll notice now that we have 4 out of the 12 work plan indicators completed. Completed probably isn't the best word to use, but you've started them. So if I go to submit, you'll see there is a message here, submission incomplete, and now we have a detailed list of the work plan omissions. So indicator 1, which I only put the comments in, is not included in this list because you have at least provided rationale that you're not working on that priority indicator. However, indicator 5 must include at least one change idea with the planned improvement, the method, the process measure, and the goal. So it's really an all or nothing. If you start an indicator, you must fill in all of the
whole line.
The whole line except for comments, which is optional. Unless you're not filling in anything because you're not working on it, then you must fill in the comments and provide the rationale of why you're not working it. So from this pop-up, you can either print this page or you can easily, copy and paste it and put it on a document and print. And then once you have a copy of your omissions, you can close it. Okay, so you can also exit out there. Mark, make note.
Yeah.
You would go back to edit your work plan, and I believe the first one was indicator 5. So I go here, and again, that was where it was saying I was missing the change idea, the work plan. So I would go in here, I would add my change idea 1, change idea 1. There is also a, oh, sorry, a new user manual, and there's lots of pictures and snippets and detailed explanation of this.
I think it's important for people to know it's not that we're trying to be mean by suggesting that you complete the row. It's trying to get the QI science in behind your ideas. So we know, like, a lot of people have really good ideas, but sometimes it's putting in that rigor around measuring it and to be getting those process measures. And the goals is really setting the targets, setting the bar high for people to really be thoughtful about what it is that they're trying to implement. there, again, is lots of resources about what process measures are and goals in the quality improvement website, the framework. So, or go to the QIP email, and we'll be able to talk to you or send you a note about resources. If there's larger groups, we're certainly interested in talking to people about quality improvement plans. So, you know, we're certainly open to having those conversations as well.
So I went in and put in the change ideas for that indicator number 5 and tried and resubmit it, and you'll notice indicator 5 is now off the list. So our advice is to print this out and then go back into the work plan and find all the omissions or blanks and fill it in. And then once you hit submit again, once the accountability pop-up window with the names of your ED and quality chair are there, you'll know that all is good and it will successfully submit.
Have to do another click to make it submit totally. So don't be afraid to click submit and see if there's any issues, because there's another step that will that you have to do to
sign off.
Yeah. So I'm not seeing other questions or where they might want us to go into the quality improvement plan. I think most people have probably had a look at it before. So
yeah, and if it works pretty much the same. However, we've implemented some of the feedback, and hopefully you'll find it even easier to use.
Now there's a comment here. Can we export into Excel or Excel-friendly format?
So I will click on the export here. That is something we did work on. It's still not perfect. However, we have hopefully reduced the number of clicks that that you'll need to do in order to format. So, I mean, this isn't a great example because I haven't put all that information in there, but we did, I know before there was lots of blank space under some of the cells, and you were having to expand some of the cells, so we have tried to improve that, but again, that'll be something we continue to work on.
Mm-hmm. Yeah. The progress reports also can be downloaded, so in different types of documents. Yeah, so for the progress report, and unfortunately I don't have a filled in one here for our test account because we never did submit the test account last year. But when you do fill in your comments and lessons learned, there are 2 options here. You can export the progress report with the change ideas, and so that would be very useful for your quality meetings and your internal meetings, and you can discuss you know, the change ideas and reflect back and create those comments. Or you can export the progress report without the change ideas, with just simply the data and the progress achieved, and that can be used for posting. For the current performance in your work plan, I just want to reiterate that value must match the value of your current performance in your 2015-16 work plan. So if those values don't match, that will be one of the error messages that come up when you try to submit. So again, we encourage organizations to perhaps start with the progress report, and we might look at moving that tab to, you know, ahead of the narrative next year. So starting with the progress report, looking at progress achieved, and again, whatever your progress is achieved or your current performance from last year, that is going to be your current performance in your work plan. So I hope that makes sense. I know it's I'm miserable.
Are there any other questions?
No, I think we're pretty good here. So
okay, so just to reiterate, please check back later this week with the narrative, with the Navigator, and we hope to open it later this week, and organizations can begin working on their QIPs and checking out the new resources. And if they have any questions, let us know.
So thank you all for attending. We really appreciate them. We have some feedback here that we're always interested to have, and good questions. Keep us all thinking. So thank you so much for being with us, and all the best with your QIP for 15-16. Bye.
Bye.